Hello everyone, my name is Dr. Ailara and welcome to yet another video. In today's video, we'll be talking about fibroid. So, big question is why fibroid? Well, over the past couple of years that I've been practicing, and lately I've been seeing a lot of fibroid patients, and they come in different shapes and forms with different problems. So, I decided that this is a very good topic for me to discuss with you guys, and hopefully you guys learn one or two things about fibroids. So, the big question is, what is a fibroid? A fibroid is a benign growth in the womb. So what is a benign growth? A growth is an abnormal tissue that forms inside an organ, and then it's benign when it doesn't spread beyond that organ, so it is just in that area. So a fibroid is a benign growth in the womb of a woman. So it is an abnormal growth that doesn't spread beyond the womb of a woman. That's what a fibroid is. So next question is, what are the other names for fibroids? Because a lot of people, you'll come across fibroids and then in different areas I'll talk about different names. So a fibroid can also be called a leiomyoma, it can be called a myoma, it can be called a fibroma of the womb. So those are the other names in case you Google and you come across other names. Okay, that's a fibroid. So we'll be talking about fibroid under different headings. We'll talk about the causes of fibroids, the symptoms of fibroid, how we diagnose fibroid, and the treatment modalities that are available. That is the scope of this video. So let's jump straight in. What are the symptoms of fibroid? So what are the things that if you see them, you think, okay, maybe I have fibroid. Oftentimes, the most common symptom of a fibroid is menorrhagia. Menorrhagia in medicine means heavy menses. So your menses starts to become heavier than normal. You start to see thick, dark blood clots inside your menses. And because you are losing a lot of blood, you may start to feel faint, weak, dizzy, and other kind of symptoms. You may also start to have palpitations where you feel your heartbeat. Palpitation is the sensation of your heartbeat, where you can sense your heartbeat without doing anything that is particularly exertional. So that's one of the symptoms. Other times you have what we call metorrhagia. Metorrhagia means you start to spot in between your periods. So one period ends, you're supposed to see your period the next month, but in between you start to see that you bleed as well. That's another symptom. Then because fibroid is a growth in the womb, it adds to the weight of the womb. You may also have what we call pressure symptoms. Pressure symptoms basically because now your womb weighs more than normal. So you may have some pain in your pelvis. So pain in your pelvis, pain in your thigh is one of the symptoms. Then because it's compressing on other structures in the pelvis, so you may go, like the bladder, you may go to urinate more frequently. So say you have frequent urination. You may also have constipation because it's compressing on your rectum, on your rectum. So you may also find it difficult to pass phases, so constipation. These are far-fetched symptoms in very, very big fibroids, not like the more common fibroids. So if the fibroid has been there for so long and has grown so big, you may start to have these pressure symptoms. Okay. Oftentimes, pressure symptoms are also very common in pregnant women because now, in addition to the fibroid, the uterus is also pregnant. So you have this baby's weight and then you have the fibroid weight, everything weighing down on the pelvis, and then that can start to give you some very serious problems later on in the pregnancy as the baby gets bigger. So other things are weight loss. If the fibroid has become so big, it's practically an organ of itself and it's become highly vascularized, then it starts to shut the blood away from the body and into the organ, and you start to lose weight as well. You see this in women that have fibroid for years and refuse to remove it because of fear of surgery. They look very slim and they look like they are chronically ill. It's because the fibroid is now so big, it's almost become an organ of its own. Then by far the more common symptom that a lot of women will experience is when you notice that you have a swelling. Your abdomen becomes bigger than normal and you're like, what is there? You can actually feel something there. That's the most common one, apart from menorrhagia, obviously, apart from the increase in bleeding during your cycle. You notice that you have abdominal swelling because now there's a mass that you can actually feel. So those are the basic symptoms of fibroid. So what are the causes? That's the next question. What are the causes of a fibroid? Well, we cannot really pinpoint that this is the real cause of a fibroid, but we can see that these are the things that predisposes the woman to having a fibroid. Basically, being a woman will make you or predispose you to having a fibroid. Because a fibroid or a tumor itself lives on estrogen, the hormone in the woman's reproductive system. That's what makes it expand. So being a woman alone and having all those hormones running in your blood will predispose you to having a fibroid. Family history. So if you have a sister that has a fibroid or a mom that has a fibroid, you're likely going to have a fibroid. Fun fact, 80% of all women before the age of 50 will have a fibroid. The funny thing is that a lot of women walking around have fibroids, but it's not really important because they don't really have symptoms. A lot of women have fibroids, it's just that it's not causing them to have symptoms and it's not big enough for them to feel it in the abdomen. It's just there, lying there in the womb. In fact, 80% of all women before 50 years will have fibroid. However, fibroids are predominant among black women. So be very careful out there. So black women, fibroids more predominant than white women, more predominant than Hispanics or any other race, black women. Okay? So next thing is, how do we diagnose a fibroid? Well, to diagnose a fibroid, again, you have to go through the basic clinical process. So you come to the hospital, your doctor says you take history. So you have a complaint, oh, I've been having this heavy menstruation, and I have this abdominal swelling that I can't really explain, and things like that. Okay, the doctor starts to make an impression, puts you on the couch, examines you. Oh, I can feel it swelling here. It's about 12 weeks, about 24 weeks. Okay. And then finally, the holy grail is to do an abdominal ultrasound. It's very cheap test. Say 5,000 most times in Nigeria, you do an abdominal ultrasound. Or you do a transvaginal, which is better because a lot of women don't want probes in their vagina. So you do a trans-abdominal ultrasound and you can really see the fibroid growth. Okay? And that's how we diagnose fibroids most times. So the next question is, okay, I've had this heavy bleeding, I have this abdominal swelling, doctor has seen me as diagnosed that I have fibroid. So what's the treatment? Well, treatment depends largely on you and your expectations, okay? And then you have to deal with this with your doctor. So I'm going to talk about different scenarios for treatment, okay? So say a woman is about 50 and then she starts to have these symptoms of fibroid. She has this swelling, she has this heavy menses that comes with blood clots, and she's diagnosed of fibroid. What is the treatment for that kind of patient? For that kind of patient, our aim is not really to go there and remove the fibroid. Our aim is to do what we call conservative treatment. So we'll try to cut off her cycle by giving her particular medication so she doesn't even see her menses anymore. Whenever she has a heavy bleed, we start to try to give her medications to stop the bleeding. The goal here is that we want, because she's very close to menopause, 50 by 55, 60, she won't see her menses anymore. And the fibroid will start to shrink, because the food of the fibroid is the hormone estrogen and progesterone. So by the time those hormones are out of the way, the fibroid will shrink. So there's no need to put her through surgery. So for a woman that is close to menopause, our aim is conservative care and try to cut off the menstrual cycle so that she can get to menopause and the fibroid will shrink. Get the scope? However, if it's a young woman that has completed her cycle and she's having these very, very severe symptoms that is disturbing her life, she's young, she's 35, but she said she wants to have 2 kids and she has had her 2 kids, we go there and we remove the fibroid. Okay? Remove the fibroid. Sometimes, if it's like very bad, or some doctors may even decide to do a hysterectomy, like remove the entire woman, let's get it done with. Okay? What if it's a woman that is young, say 30, 20 something, 35, and now she has never had a child before and she has a fibroid? Goal is go there and try to remove the fibroid. Okay, that's our goal. We want to go there and try to remove the fibroid, because one of the biggest complications of fibroid is infertility. Because fibroid is in the wall of the uterus, sometimes it can distort the uterus such that the pregnancy cannot implant in the uterus. So what we want to try to do is go there and remove the fibroid so she can actually conceive. That's one of the big complications of fibroid. In fact, it is infertility. It can lead to infertility. So what if she's young and has not completed her cycle, has not completed her family, and she's like, see, I still want to have kids, I'm not ready to go through anything. So we still go there and remove the fibroid anyways. So the treatment depends on the patient's expectations, whether or not she has completed her family, how close she is to menopause, how severe the symptoms are, and you really have to sit down with your doctor and discuss the treatment, because we can use drugs. There's also surgery, but the holy grail if a woman is infertile is surgery. So all these factors come into play. Family, is it completed or not? The woman's age, that means well, trying to track menopause and other factors like that. So you really have to sit down with your doctor and you guys have to talk this out. Okay, but most times in clinical practice so far, most women get to know that they have fibroid when they are looking for kids. They will have this abdominal swelling for a while and they just ignore it, and then come and it's a fibroid that's been sitting there all this while and that's making them infertile. So that is it. So that is all I have for you guys today on fibroids. I'll be dropping another video next week. I don't know what it will be about. If you guys will give me suggestions in the comment section below, I like it. Please make sure to like this video, share and subscribe. Let's try to grow this channel as much as we can. I'll see you guys in the next video. Have a nice day. Thank you. Bye bye.